Jason, thank you so much for coming on Startup Steroid today. I'm excited to sort of talk to you and learn more about LearnCdo and how you're building out the company. Before we get into the specifics, start by introducing yourself.
Yeah, my name is Jason Merrick. I'm CEO and president of LearnCdo. And for our initial launch, it's LearnCdo Care. So that is kind of our name for the launch of our MVP coming on June 24th.
Okay. Tell us a little bit about your background, how you sort of got started, and any relevant experience coming into this.
A lot. So there's I have two kind of deep background experiences that feed my experience as a new CEO at LearnCdo. So two tracks. One is healthcare. I've been in healthcare for over 20 years on many different sides of it in multiple areas. I started as a first responder when I was like 18 or 19. Went on my very first emergency call at that age. I still remember it. I've had thousands of experiences or encounters with patients since, but I still remember that very first one. The road, the situation. It's like a flashback to me, and that's what started it. I've since then in medical care, it's a lot of it's on the emergency side. Kind of that adrenaline junkie, and evolved from there. But first responder, EMT. Paramedic, kind of on that background, firefighter as well, professional firefighters. So I've had that experience in the emergency side of things, seen a lot, done a lot, and then also in the more institutional setting where I've been an ER tech, a teletech. I've also now been a licensed nurse and charge nurse as well. So I've had both the experience on the street and the institutional kind of larger hospital setting experience as well. So that's my healthcare. And then also separately, I had startup experience. So when I graduated UC Davis in 99-2000, what was then an incubator, now I think we call it an accelerator. But I was in a part of a program while I was going through UC Davis, an incubator program, and then was the first intern at the University of California Davis's incubator called UCD Connect. So I helped kind of get that program going as the first intern there. And then from there, I joined through my different connections and work. I got connected with a media or cable executive from A&E and History Channel, and we worked on launching a telecom in Mexico. And then from there, we worked on lifestyle media channels, and my startup experience has grown from there as well. These two merged for me, in 2019 when my daughter was born. So, when she was born, I was at the time I had met my two founding partners, and we were working on a expert guided video call app, a new app on how to deploy it. My daughter was born. And I had the experience as a new parent, and it was quite obvious that the pediatric space and telecare and telehealth was lacking, and it guided us to where we're at today.
Fantastic. So I understand that you're interested in the pediatric telehealth space, but tell us a little bit more about that vision. What was the initial idea behind starting that vision?
Right. So the initial idea was, at the time, I had started coming up with the idea early 2019, and I thought that mobile video was underutilized as a business avenue. It was just being used to web conference, not nearly as much as it is today. It was being mostly used peer-to-peer, and I thought there was a great, commercial side to mobile video and mobile video conferencing. So beyond, just a board meeting or hosting a meeting, but where it could be a dynamic medium for an expert to provide advice to a user. So that's where it started. And then I saw the benefit of being a new parent on how much a parent was kind of just left out there alone on an island. So not only did we see the commercial aspect of mobile video, via your mobile phone, your smartphone, but also the space was pediatric, and then pandemic hit, and the rest is history. But the initial thought was that we could, and basically empower an individual to do something themselves. You had Upwork, you had TaskRabbit, you had all these services that allowed you to hire somebody to do it for you. But what about empowering you to do it yourself? I have an idea, I have a knowledge, I just need some advice, somebody to take a look in what I'm doing, and empower me to do it for myself. So that was the initial thought, and then we concentrated on the pediatric healthcare space.
So I love the idea, and I love the motivation behind empowering parents to do it themselves. But why focus on the pediatric end? Because most telehealth companies, especially back then, before the pandemic, were more physician focused, more sort of broad spectrum. What made you decide into going into this pediatric space specifically?
Twofold. Pediatrics can be largely segmented by developmental stage and age. Those two don't always necessarily coincide with each other. So there is the opportunity to focus on a segment of pediatrics without having to do the whole pie. And that's from conception to 18 years of age. And there's many different segments in that age range, both based on age and development, that you can concentrate on and just focus on. You add to that, and I can tell you anecdotally, and I would say most medical expert or medical providers, clinicians, whatever it may be, would agree with me. It is very hard to change adult behavior. Very, very hard. So what you're seeing with all the technology out there today has a very marginal, in my opinion, approach to it, because you're changing behavior, and it's very hard, as we know, to change behavior. So why change behavior? Why not create established behavior? So we do so by working through the parent to create that behavior with healthcare, with development, with that whole spectrum from the beginning. A parent is very engaged. They want the best for their child. So we want to be part of that process and establishing the behavior, rather than in 50 years change that behavior. So we can have a much bigger difference early on than 50 years down the road.
That's fantastic answer. And that's a great sort of, when there are new parents, they have tons of questions, and I think it's a fantastic market that you've picked. So now that you have an idea, now that you have this sort of vision to create this app, how did you go about doing that? What players did you bring in to put the right pieces in place?
Right. So I've had, this is my fourth or more startup that I've been involved with. And this is the first where I said, I'm taking over. I'm going to do it in my vision, take all the experience I've had and run with it. So, what I learned two things early on through my experiences. One is the biggest effect you can have is the team you choose. And two is get a general counsel, legal advice from the beginning. So those were the two things I implemented right away. And so the first person that I got on board was Mark November, our first advisor. And we only have 3 advisors at this time. So we're very selective in the advisors we choose. We don't believe in a large board that just looks good. All our advisors are steeped in helping out in the front line of our startup, if you will. And so Mark November came in at the beginning, and what he does really well is build executive teams, build founding teams. And I reached out to Mark and I said, hey, I have a great idea. I need your help building the team because I don't have anybody in mind right now. That's what Mark does. That's his specialty. And he helped me build my executive team. We all get along real great. There's only 3 of us, and we each bring something different to the table. And so we're very synergistic. And that's when Mark came in. Not only did he help us build our team, but he helped us add the advisors and then kind of industry connections. So he's just a connector. And that's why he was a great first advisor, because he builds teams. Secondly, I found our general counsel, Katie. So she came on. She's helped divert us from some big mistakes, adding advice, giving legal advice, creating contracts, but just watching our back from the beginning. So that's kind of the 2 first people, and I'd say that's what I've done from the beginning. Then afterwards, after Mark, after Katie, the next two people that came on were my executive team. First was Mustafa Sayrek, who's our CTO. Deep technology experience, both from the kind of just the worker perspective all the way up to the manager to the head of a department. So he brings that depth of knowledge. I know teams work really hard for him. So he's brings our technology side. He's worked at Ingram Micro, Qualcomm, Sony, where he's director of engineering, head of engineering for Sony Crackle, which now grew to 19 million users before being sold and is now, I think, one of the largest free streaming services on your TV. So he's had success in technology, and mobile and video is his sweet spot. So he knows what to develop. He knows how to build it. He has the vision. He loves the app that, came on board, loving the idea. And then Sam, he operational perspective, also marketing genius. He's grown and ramped up startups and tech companies. Most recently, Booking Live out of the UK, which is now global. At the time was only in the UK, so he's expanded it with the global outreach and then the partners in every country as well, or customers, which is a B2B model. So Sam is well-rounded. He's grown tech companies. He understands marketing. So these guys came on. They bought into my vision, and they've helped us grow to the point where we're ready to launch.
That's fantastic. So you've been doing this. You said you started about 2 years ago, so 2019.
Yes.
You started building the platform and then ran headfirst into the pandemic. So tell us about what happened in 2020 when the pandemic hit.
It just validated the path we were already on. We didn't really have to. I would think it did, from a regulatory perspective, it made things easier, much easier for us. It did two things. I think the biggest things is we didn't divert much. We saw what was coming. It probably accelerated the industry, by 5 years or more. But from our perspective, we were already seeing that eventual change. So it validated our vision. But from a kind of, I guess you would say, nuts and bolts perspective, it did two things on the ground. One, accelerated the regulatory map. So, the feds put an emergency basis where you could have remote healthcare consults. And then he accelerated the insurance paradigm by allowing telehealth visits to get reinsurance from Medicare and Medicaid. So that's one thing. But alternatively, it greatly increased our potential competition as well, because a lot of people saw our opportunity where, we were sitting pretty comfortably and where we were coming from, and but it opened people's eyes pretty quickly. So competition is good. We don't mind, but it definitely hit that accelerate button from that side as well.
Absolutely. So now you're just getting ready to launch your platform. So tell me sort of what sort of process you've gone through, that initial alpha product and how you sort of tested and so on and so forth.
Right. So, again, this is where my past experience comes into play. From the very beginning, as we've, our development team was built from Mustafa's connection. So it's the best way to build a team. It's all come together from people he's known who knew people. So it was organically built. Everybody got along real well. They were all on the same page. So the team came together nicely. At the same time, we built a focus group. So the focus group, we have a focus group, what I call a focus group. There's different names for it now, but it was made up of healthcare experts that were also parents. So they added two perspectives to that developmental phase. So as we created the development team, in parallel, we created a focus group, which was made up of kind of people that had carried two hats, so demand and supply, if you will. They were parents, and they were also healthcare experts. So an ER physician, an ICU, pediatric ICU nurse at UCSF. We had a woman who was a new parent as well, who owned a group of physical therapy offices here in the Bay Area. She has business owner herself. From the mental health side as well, a child interventionist who worked with the worst, very poor family situations for children on the mental health side. So we had 6 of these experts that come in from that side of things and added perspective on whether or not this was a core need for an app that they would like to see built from both a parent and an expert's perspective. So that, in conjunction with our development team, kind of both starting in together in parallel, had a lot of energy, and they fed off each other. And a lot of the design features of our app have stemmed. We had weekly meetings, so we didn't just kind of, wasn't a token focus group. It was embedded with development. They had weekly meetings, and so every week it was being developed. They had meetings with our focus group as well on Wednesdays. So that's been a unique feature of our development side of things. We decided to develop both Android and iOS at the same time because iOS, a lot of people in the United States use Apple, some use Android. It was hard to diverge the populations into two. There wasn't a clear distinction between the two. So we had to do both at the same time as well. So that added kind of a little bit of labor to our app. And then two, we decided to make our app superior technology-wise. So we put a lot to the back end as opposed to the front end. So our app is only somewhere between 22 and 33 megabits in size. Very fast, very lean. You have Zoom, which is about 130 something megabytes, 135, 137 megabytes in size, and where we have about 50 to 60% functionality of Zoom through our app for just MVP. And all our features, our development teams have the experience, including our CTO, of feature creep. So every feature that's been included has found a need. It is not a nice to have. It is we think it's necessary to have. So those aspects of our development have really created a streamlined app. Our development teams in Argentina, part of our development teams in Argentina. So on a regular basis, we've been testing it from the US to Argentina to make sure it has a high fidelity of streaming. So we know that aspect. And then for launch, we got approved both on iOS and Android for beta. And it's invite only because we're HIPAA compliant. That's another thing we've added into our development as well. So we're by a third party consultant who has certified us. So it's official. That's added to. And now we're finishing pen testing because of HIPAA and because of what you see with security out there today, the security concerns on data and privacy and health information. So it's a robust initial app that's been thoroughly tested, further tested when we launch on a market scale in Arizona.
That's fantastic. So yeah, it seems like you've done a lot of great work to sort of come to this point. Now, when are you launching your app? Tell us that, the date.
June 24th in Arizona.
June 24th. And initially, you already have a huge list of professionals as well as customers. Let's talk a little bit about how you sort of work both of those. And I think you're going to start with a small number of professionals first, right? Only about 10 or so professionals first. So tell us how you sort of built out that list and how you're focusing on these 10.
Right. I think it was again, this is another aspect where I think the pandemic really helped us. There was, at the time, we just literally almost a marketing budget of zero. I think now we're paying for a subscription at $250 a month for the last 3 months. So a total of less than $1,000, and that's about it, all we spent on marketing to get here. But we just opened up our platform, which was a landing page, posted some free ads, and within a little over 2 months, we had over 16,000 experts from across the U.S. apply to our platform. Because it was resonating at the time. There was a lot of nurse practitioners, a lot of people associated with primary care groups out of work. So they were looking for opportunity, and they stumbled on us, and then word of mouth. So it just grew organically from the expert side of things. And that's kind of how it's grown in every state, high concentration, California and Illinois, now just nurse practitioner in Arizona. And I think people are starting to realize the great, how versatile nurse practitioners are and how valuable they are as well. So I think in California, the opportunity is huge because in 2023, and just a little under 2 years, I think in California, nurse practitioners are going to be able to practice under with their full license without having to have collaborative agreements with physicians. So they are going to fill a lot of the primary care space in California. That's
Let's
you see.
explain that a little bit more, because the distinction between a nurse practitioner and an RN isn't necessarily clear to everyone who might be listening. So explain that for us first.
Right. So a huge difference, night and day. It's the difference between an EMT and a paramedic as far as RN and nurse practitioner is concerned. So an RN we practice, I'm an RN, under the strict supervision of a physician. And we're limited in what we can't prescribe. We can't put in orders. We can't diagnose. We follow the orders of the doctor. In order to do anything substantial, and there can be a lot underneath that saying, but we have to get the authorization of a physician as well.
Right.
We can do some skills that we have. We can deliver medications. We can't prescribe medications.
Yep.
So that's a distinction. We can't put it in an order. We have to go to a physician and say, hey, this is what's going on with the patient. They have a pain in the right arm. They fell 2 weeks ago. What do you think we should do? Oh, put in an X-ray. Great. Could you put in an order for the X-ray?
Right.
So that's kind of what, RNs are very limited in that way. Nurse practitioner, however, has a higher level of certification, more education, has a master's, sometimes a doctorate, and it's going that direction. And so it's a DNP or a FNP, which is family nurse practitioner, or primary nurse practitioner. And so right now it depends on the state. So let's say use Arizona, for example. That nurse practitioner can't put in a medication order. They can prescribe a medication. They can put in an order for that X-ray. They can put in a diagnosis. So they can do a lot, not everything of a physician. They don't have that 7 years. It's not the same, but at level. But for a primary care, it is often enough. They're not surgeons, but they have that experience, that background, and that education to be able to act in that primary capacity. Also, they have that experience to be able to say, okay, that's a fever. You take Tylenol for it, or, we think it's an infection. We're going to put in a prescription for antibiotics. I need to learn a little bit more about you. If they're going to put in a medical order, then they have to get a little bit more deeper into that background. That, what are your allergies? A little more than that, but they can then go into that paradigm or into that aspect. So
right.
RNs are very limited from that initial assessment. Nurse practitioners can carry it to the next step.
Exactly. So I think that's such an important thing to know when we're having this discussion. When you're talking about Arizona nurse practitioners, you're talking about the folks who can essentially run a practice independently and can take care of all of these things for their patients.
Right.
So I think that's a very important thing. So now June 24th is the day you're going to launch. What's the next step? What are you hoping to accomplish in, let's say, the next 12 months?
Right. So the next 12 months, it's multifaceted. We can, a lot of ambition, but, with the experience, very strategic in how we expect to grow. We are going to grow technologically. I haven't talked much about our app at all, but we have unique features like the ability for our experts to, if you were to use Zoom, for example, if you were to use Google Meets, you recognize that child's in distress, you tell the parent they have to call 911, then you have to hang up and hope they call 911. You maybe call them back. So with our app, the expert can swipe and then confirm that they meant to call emergency services beyond that app with that parent as that ambulance arrives. So they don't have to leave the call itself. How important that is from being a parent and concerned to being the expert and having that concern to be able to stay in communication through the call itself. And that came from that focus group and that development team interaction from the beginning. So we've embedded that in our app. So there's features like that are part of our app. Medical record-wise, we think we're on the forefront of that as well. In the way we look at the recorded call itself. So further develop the app based on feedback that we receive in our development team and keeping everybody together with that pace, getting to a B2B model. So being allowing, we look at one of our 3 initial customers as primary care practices. So where we provide after hours services. So middle of the night, weekends, holidays, we partner with the primary care provider, and we within 6 months or sooner, we'll have that B2B model where we can partner directly with those primary care groups. So there's the building of the app itself, the technology itself, and then I think from a demand side, it's kind of growing within Arizona from the nurse practitioners. So building that referral network first for parents with young children. So physical therapists, doulas, certified nurse midwives, things that a parent with a new child would kind of specialty wise that would be interested in, so that nurse practitioner can be okay, we think this is mobility related. Would you like to talk to the physical therapist right now? Great. Well, this is one that's available to you. They can't do certain referral laws, and each state has their own, but it could be a suggestion. This is available to you. And then they can jump on and talk to a physical therapist. So building out that additional revenue line with specialists, at the same time expanding to California. So what we're doing in California is we're looking for a chief medical officer, because within California, for our nurse practitioners to act within their full scope of their license, they have to have a collaborative agreement with a physician who then oversees the advice they're giving and how they're working and operating. And again, 2023, that's going to change. But until then, we have to have the physician overseeing how they operate. So we're looking for a chief medical officer to oversee a professional corporation or a PC, and then also adding in LearnCdo as a MSO or a management services organization to act. So we're building a regulatory structure to enable our model in California at the same time. So I would say it is growing in scale and scope within California, Arizona, and then additional states as makes sense.
Perfect. Okay. And I think that rule change, I think, is going to skyrocket the demand also. So I think that's fantastic. What's the grand vision for LearnCdo? Let's look out, 3, 5, 7 years. Where do you see this company going?
Again, it's very simple. And it's a big statement. It's an ambitious statement, but being the number one pediatric care provider in the U.S. And it starts very humbly with this advice line. It can grow into primary care. It can grow into monitoring, so baby tech as well. It can grow into having our own offices, serving underserved areas like the rural areas where we know. What's happened across the U.S. is that you have primary care that's centered around hospitals. Hospitals have a great function, but they shouldn't be the only function in healthcare when it comes to practice and distribution. So look at areas that aren't serviced by hospitals, which is large swath of the U.S. So how can we fill in those gaps where there's a lack of care as well? What about mental health for older children? Getting into that aspect as well. As you get into adolescent, as you get into preteens, as you get into toddlers, there's different care models for these children as well. And what about providing for the entire child? So that gets into education. So there's a lot of opportunity for us to move into, and where we see that demand going, both technologically and demand and service levels, is where it will expand to. But I think overall being the number one pediatric care provider in the U.S.
Fantastic.
And then, of course, I think we would dovetail into a large provider, depending on what way Amazon goes, what way Walmart goes, CVS, it could be Aetna, it could be United Health, who's getting a little bit of flack right now. And then it could be Teladoc, it could be Amwell, but I think we dovetail nicely into adult, chronic, and elderly care as well, a whole different segment of the population. So, pediatrics fits into large players nicely.
Fantastic, and there's obviously a lot of opportunity to grow in those markets. So I think you have a fantastic vision, and I think you're getting started in the right way, putting the right pieces in place. So. Congratulations on that, and best of luck for all of the future plans that you've sort of laid out. Thank you very much for coming on today, and let's continue the conversation. Keep us posted on your progress, And investors who might be listening, who, if they're interested, look on in the description for the links to connect with Jason, and to learn more about his company. Log into Startup Steroid, the entire profile, including his pitch deck. All of the documents are there as well. So Jason, thank you again for coming on and sharing your story with us. I really appreciate it.
Thank you, Val. I appreciate it. Thank you.
Absolutely.